Good morning, Dr. Das. It is a great pleasure indeed to have met you today at St. Joseph's Hospital. To begin with, may I just ask you please that how long you're associated with this hospital, sir?
At the very beginning, may I welcome you, Mr. Gomez, on behalf of St. Joseph's Hospital at Midnapur. I am attached with St. Joseph's Hospital for the last 1 year as a consultant oral and maxillofacial surgeon, which deals with the diseases of the oral cavity, face and neck as well.
Doctor, can you kindly say something about yourself, please, as to your education, qualification, and your specialities?
Mr. Gomez, so this specialty, oral and maxillofacial surgery or the face surgery itself, it's a very much upcoming trend nowadays. For getting the training into the oral and maxillofacial surgical specialty, I did the undergraduate from North Bengal Dental College in 1999. After that, I worked for 5 years as a resident in the maxillofacial surgery in Calcutta, and then I moved to UK. I stayed there over 8 years, where I achieved my membership in the specialty from Royal College of Surgeons, England, and followed by getting the fellowship from Royal College of Surgeons in Ireland. After that, I came back India in 2012, and since then I'm working here, in this city, Calcutta. Now I joined in St. Joseph's in last April 2015. So to become a maxillofacial surgeon, apart from the basic training in dentistry, because at the end of the day you are going to deal with the oral cavity and the face, which the dentist is the best person to judge. I got my training in orthopedic surgery, in general surgery. I worked a bit with the ENT surgeons and plastic surgeons and emergencies as well. So after finished off my training, after I came back in this country, I had to operate around an enormous number of the victims of the road traffic accidents, where they smash their face along with the other parts of the body. I do operate on the babies who born with the facial deformities, especially the cleft lip and the palate, where the common people they call it as a hair lip. I do operate and treat the oral cancers along with the reconstruction. And you know, as the days are changing, people's demand, the patient's demands or requirements are also getting changed over the time. Now, after crossing 50s or 60s, the patients, some of the patients, they come and ask for a bit of change of their facial profile by facelift or nose job or lip job or eyebrow job as well. So I deal with the facial plastics as well.
That's very nice to hear, sir. Could you kindly tell me, sir, about this specialization? Is it very much required in this type of a rural area?
Very relevant question, Mr. Gomez. Whether it is very much relevant in the rural setup in India. As we all know that the oral cancer is prevailing nowadays, and it is an upcoming threat for the entire nation across, not in India only, but across the world, because of the uses of the tobaccos, the alcohols and other oral habits and lifestyle changes. The oral cancer is just flaring up like a tsunami. unfortunately, the people from this part of our state, West Bengal, the patients, they try to visit the other states for getting the treatment of the oral cancer. Yes, we can treat the oral cancers in this hospital, though we do not have the radiotherapy setup right at this moment, but very soon we are going to start up the radiotherapy setup here as well. And if when it would be all ready, then we can give consolidated treatment of the oral malignancies or oral cancers to the patients. But till then, yes, we do operate and reconstruct the defects of the face suffering from the cancers. Yes, we do operate on the patients with the facial traumas. Yes, we do operate on the patients, on the babies with the congenital or the birth defect of the face.
That's very nice to hear, sir. Sir, tell me, in the cosmetic sense of it, how does it help the patients that you have treated so far?
So before coming to about the cosmetic aspect of the treatment, we will have to consider the different age group of the patients. Because in different age group, the requirements are different. Say, when I see a baby with a cleft lip or the palate, it is not the cosmetic which comes as a priority. It is the function which is more important at that stage. So for repairing the cleft lip and palate, my priority is to establish the functional or the function of the facial muscles and the lip and the palate rather than the cosmetic at the very young stage.
So this means, sorry for the interjection,
Yeah.
this means that it is a totally a complete new life.
Even if it is not a new life, after getting the treatment, the patient gets the confidence and they can stand up and establish themselves in the society or in the profession, and they can go to the top of the ladder in the profession with the full of confidence.
Very well said, sir. Sir, just one last little question over here. Where do you see St. Joseph's Hospital, Midnapur, go from this stage into the near future?
Mr. Gomez, let me frame it up in a different way, sir. In the near future, I want to split it in different phases. I want to see it in next 5 years, next 10 years, next 15 years, and next 20 years, in that way. Next 5 years, I am pretty much confident that not in West Midnapur only, but in South Bengal, St. Joseph Hospital is going to establish it as one of the biggest multi-speciality hospital. It may not have the corporate glamour right at this moment. So we will have to put the framework in 5 years, 10 years, 15 years and 20 years time like that. In next 5 years, our target is to establish the St. Joseph Hospital from a rural setup hospital to a multidisciplinary or multi-speciality hospital in West Midnapur district with the facilities of giving the treatment from general medicine, general surgery, gynae, obstetrics, orthopedics and dental and face surgery as well.